A to Z CO tools. Dengue fever is a mosquito-borne viral infection which has a sudden onset that follows symptoms such as headache, nausea, weakness, intense muscle and joint pain, swelling of lymph nodes, lymphadenopathy, and rashes on the skin. Many symptoms of dengue fever include gingivitis, sharp pain in the eyes, and swollen palms and soles. Dengue can affect any person but appears to be more serious in immunocompromised people. Because it is caused by one of the 5 dengue virus serotypes, it is possible to have dengue fever multiple times. Nonetheless, a dengue attack provides lifelong immunity to the specific viral serotype to which the patient has been exposed. This disease may also be called breakbone fever or dandy fever. This dengue fever may become more serious and then named as dengue hemorrhagic fever and dengue shock syndrome. Dengue hemorrhagic fever is a more severe form in which hemorrhages occurs in the body. It is a life-threatening condition, and it may progress to the most critical form called dengue shock syndrome. The pathophysiology of DENV and the immune response of the host are not fully understood. Primary manifestations of disease include capillary leak syndrome, plasma leakage due to DHF-specific endothelial cell dysfunction, thrombocytopenia, seen in all types of DENV infection, but extreme in DHF, hemorrhagic tendencies, and leukopenia. It is known that the major viral envelope, E, of glycoprotein in the virus helps to bind the host cells, followed by viral replication. Dengue virus is the most common mosquito-borne infection in humans all over the world. It belongs to the family Flaviviridae, which contains more than 70 viruses, in which DENV is transmitted by the Aedes aegypti and Aedes albopictus mosquitoes. Dengue virus is spread primarily by Aedes mosquitoes, in particular Aedes aegypti. These mosquitoes usually live between 35 degrees north and 35 degrees south below an altitude of 1,000 meters, 3,300 feet. They usually bite especially in the early morning and in the evening. Certain Aedes disease-borne species include Aedes albopictus, Aedes scutellaris, and Aedes polynesiensis. Human beings are the primary hosts of this virus, arousing even non-human primates. An infection may be obtained through a single bite. A female mosquito that consumes an infected person's blood, within a febrile, viremic span of 2 to 12 days, becomes infected with the virus in its intestine. The virus then spread into other tissues, including the salivary glands of the mosquito, approximately after a period of 8 to 10 days, and is subsequently released into its saliva. When it bites the other person, the virus is transmitted through its saliva to that person. The virus does not cause any harm to the mosquito.